All right, so maybe this would be a good time to do kind of an intro to one of the things I want to talk about, and that's healthcare. In the United States, we are far worse than other developed nations, other wealthy nations, and that's because we don't employ some kind of a universal healthcare system. If you haven't looked at this, I highly recommend you look at the comparison. And I'm gonna put something out. If not today, maybe tomorrow. Because I did a bit of a deep dive in what the different parties generally propose and how they compare to other healthcare systems. But like, what's not on my bingo card is the fact that Marjorie Taylor Greene is the only Republican that's talking about the fact that people are in really dire straits in this country when it comes to healthcare. Like, generally people's expenses are going up. Like, our energy costs are going up. Many people are going to see radically increased costs for their energy. And there's some reasons for that I'll probably cover in another video. It has to do with these like data centers for things like AI and like Bitcoin mining and all this other stuff that doesn't actually do very much for people unless you're really rich. But it's wild to me that Marjorie Taylor Greene is talking about this. There are like progressives that have been talking about this stuff for a long time, but they don't get as much attention and they don't get taken seriously. But people, I guess, are calling Marjorie Taylor Greene like a California liberal. Like, we're in a lot of trouble. If we don't fix these problems, I don't know how else to say it, but it's going to be deadly for tens of thousands, if not hundreds of thousands, and eventually millions of Americans. Like, we are about to go into what is going to be best described as a insurance explosion spiral, because when the parts of the budget bill kick in, I think it's supposed to be in 2026 after the midterms. Of course, Republicans would time it that way, so the worst of this stuff doesn't hit until after the midterm elections. Some things are going to hit before, though. I forget which elements. Please excuse me. I've had 2 days where I didn't get that great sleep because I was working on some content and I couldn't stop thinking about it until I finished it up and posted stuff. So the problem is, when the health insurance premiums go up, it's going to get to the point where a lot of people are just not going to be able to have insurance. And the way that the insurance works is you need to have a decent sized pool. And because we have like a whole bunch of private marketplaces, the pools are sort of reduced in size based on the pool that you're in, which creates other problems, which is one of the other reasons why progressives and people like me, I think I kind of fit into the progressive category. I don't like labels. I don't like to be sort of pigeonholed. But in terms of like healthcare, I support universal healthcare, because if you're okay with the idea of insurance, meaning you have like a big risk pool, so you have more people that are lower risk, that balances out the higher risk people that need more care, that have serious conditions that require more treatments and things like that, and some of that's expensive. It balances out the risk. But when you have a bunch of these smaller pools, that gets really impacted pretty quickly if you have a bunch of people that are dropping out because they can't afford it, which means when a lot of people drop out, or if there's other cost shocks, the premiums go up, and that also could probably impact other people's coverage who remain, which could also further kick more people out. So, I mean, that ultimately, I think, spells the collapse of the healthcare system, which is always going to impact poor people more first, because the people that have more money can handle the extra cost, maybe. But I don't know what's going to happen, and I haven't heard anybody's plan to address this at all. Like, I would argue we should just so if we had more time and we had people that actually were responsible with this stuff, there's some models that you can mitigate some of the risks of the shocks that's going to happen to the private health insurers and the people that are involved in those jobs and the hospitals and stuff like that. There's ways that you can minimize the amount of harm that's done if you do it over like a transition period. That might be a multi-year thing, which is difficult in our politics because it seems like everybody is so short-sighted. And even though Democrats will often advocate for things that are going to help more people, I would argue they still don't go far enough. I think that's partially because they're impacted by the insurance lobby. I'm pretty sure the insurance lobby donates to the Republicans too. I haven't really looked at the numbers recently on that. But the problem in our country is you have the Democrats, I think, maybe balancing out the needs of the people, but also catering to the for-profit industry. Whereas the Republicans don't seem to care about how many people get hurt. Their priority is for the for-profit industry. And, you know, you can have a nuanced look at that all you like, but I think that's the best way to break that down when you simplify it. Because if my priority is not about profit, my priority is how do we do this in a cost-effective way, because it's going to, like, I think it should be paid for with taxpayer dollars. I think we have to capture more dollars from the top earners because they extract the most, they benefit the most from the economy. So I think they have a responsibility to take care of the people that they need in order to keep making what they're doing, what their businesses do, what they want to do. So they need a lot from society, and we all contribute. And having a healthy society is important. And if we're all invested in it, we would all care more about the different aspects that, you know, like we would look at things that are preventative. We would look at things that might be better in the long run, like cures, instead of things that seem to be just maintaining the diseases that we have, or look at the different contaminants in our environment and look at minimizing those and look at alternatives and all that stuff. Like, there's a lot of different things that can happen if we're all bought into the same system. And from my research on this, the evidence seems to point to the fact that a single-payer system, a universal healthcare system, would not only be cheaper, like by about half, I think. And a big part of that is you cut down on the administrative costs, and also you cut the for-profit middleman out. And yes, like we can't just change overnight. But I don't know how we address what's coming right now with the rises in healthcare costs that's going to kick people off. It seems to be based on short-term thinking, like we're going to allow rich people to get tax breaks, and maybe they'll get a little bit more profit because some percentage of that increase is profit for the shareholders, which is, most of that is like over 85% or 90% of the stock market is owned by like less than 4% of very rich people. And we're not getting that back. We're not really getting a return on allowing them to hoard that much wealth. And it seems like it's enabled them to just get a mafia, authoritarian, fascist regime that blocks us from any real reforms, gets them permanent tax breaks, gets us more debt, and more people are going to die, including MAGA folks. Like, people in red states use a lot of benefits like SNAP, like WIC. They have people that in their families that have disabilities, that are probably going to lose their services. They use Medicaid and they use Medicare because they need it, and I don't begrudge them for needing that. Lots of us do. I don't think I use that stuff, but I want people to have it. People that I care about use it. People that I serve use that stuff. Yeah, so I don't know, and it seems like people are getting baited with a lot of misinformation, but you can't run from the cost hikes that are about to hit. You got people losing jobs all over the place. You got service members in food lines. Why am I blanking on that? Yeah, where like troops are not getting paid, and they may not get back pay, or did they? They might have figured out how to get those guys paid. And then what the hell's going on with all this tariff money that Americans got charged for? And then who's going to end up with that? Is that probably just going to end up with rich buddies of Trump and maybe a small kickback for MAGA, or I don't know, maybe Democrats get some, probably not. I don't know, guys. Like, this is really worrisome, because like, it doesn't matter to me what your politics are. I want you to be okay. I want you to have a better life, and I don't think this is how we get it. I don't think having fascists in charge of our government that are just declaring mass numbers of Americans that are the most American among us. People that are anti-fascist are the most American of us. That's people like me. I'm a veteran of a foreign war. I served in Iraq for 8 years. I served in the Guard, Army National Guard, for 8 years in New York. I did a tour in Iraq in 2008, 2009. I joined after 9/11, 2001. I ended up starting in like March of that year, or the following year. My grandfather was anti-fascist. He served in World War II. Antifa, our founding document, our documents are things like the Declaration of Independence, our Constitution, our Bill of Rights. And we stand up for just laws, and we stand against unjust laws, and we stand up against tyranny. We have a tyrannical government. They're sending in our troops to spend money and do nothing to spread fear in our U.S. cities, blue states and cities. They're using ICE to kidnap people and rendition them to third nations, to concentration camps, to for-profit prisons, using technology that these people in this regime personally profit from, like Citigroup and Geo Group, using technology like Palantir, which Peter Thiel literally groomed J.D. Vance and funded his campaign so he could become vice president. We're getting manipulated all the time by media that right-wing billionaires own. You got jagaloons like RFK Jr. spreading misinformation about health, public policy around health. The same people that spread misinformation about COVID and the vaccine and all that stuff. Like, I've lost... Guys, listen. If you're confused about vaccines and you don't understand how we do the math on that and why we use them, and you don't know the history before we used a lot of the vaccines that we've used in the past and presently, I get it. But you should look at the history. You should look at what happened when, people had smallpox in this country. When people got the measles more frequently. When people got certain flus. Vaccines are really important. They're not flawless. Some people are going to be hurt and have bad side effects. That's always going to happen. It's never going to be perfect. I don't like the fact that the thing had to be developed so fast, but I do credit Donald Trump for Operation Warp Speed. I also have to give him a negative for cutting back on the CDC and cutting back on a lot of preparedness measures early in his presidency the first time. So I can give him credit, but I can also give him a knock because he made us less prepared, put us in a bad position. We did not have people that were in charge of monitoring things as that pandemic progressed. And then we were late. And then we had to do Operation Warp Speed, which unfortunately undermined public trust. And the Trump regime and the many people in the Republican Party and people that are affiliated, their pundits, through their misinformation and disinformation, they undermine public trust, which has been a long-term project for Republicans in this country, conservatives in this country. They've undermined government. They undermine public trust because they want to prove the case that government doesn't work so they can privatize things because their donors benefit from that, and many of them do also. They're not interested in governing for the good of the people. They're not. They have never been interested in governing for the people. To the extent that they do, it's because they have someone that is close to them that was impacted somehow by something that they need to act on. It's about the only time. And again, I know I'm making general statements here. I understand that. I know there's going to be examples that dispute what I'm saying here. I'm sure that's the case, actually. And I'm not saying I'm not saying Democrats are perfect. I'm not saying Democrats are always better in all cases against Republicans. I'm just saying in general, that's the case. But the more money has been involved in our politics, the worse things have gotten. That's the big concern. And that's one of the reasons why we're in this healthcare mess, because we have prioritized profit. Like, I had concerns with the Affordable Care Act, which was formerly Romney Care, a Republican plan. I think Romney Care might have been slightly better than the Affordable Care Act when that got put in, because of the process of bad faith actors in the Democratic Party that are very conservative, and Republicans stripped out components that would have made the Affordable Care Act better. It was still better than what we had before, because healthcare was expensive, and you'd basically be denied coverage if you had like a pre-existing condition, which is a uniquely American thing. Like America, like in other parts of the world, they just refer to that as your medical history, and it's relevant so they can give you care, and they make sure they're keeping those things in mind. But we don't. We do things like wallet biopsies here. Like if you go to the doctor, they might present you different options of what they can do. I'd have to wonder if that would be the case at all if we had a different system where it was basically just like, oh yeah, we got to make sure that we do all the essential things for you, so we catch everything that we need to, and we do the treatment that we need to. We don't want to miss anything, because if we miss anything, it's going to be worse down the road, and then you're going to have to use even more services. Preventative care is one of the best ways to cut down on costs. And one of the problems that we have in this country, because of, frankly, racism and short-sighted thinking, people are creating barriers to good health care and more cost-effective care. So people wait, and they end up going to emergency care, which is the least cost-effective. It's the most expensive, and it's the worst way to get care unless it's really relevant. Like, accidents happen, things happen that we weren't expecting, and you have to get care, and that's totally normal. But for things that could have been handled sooner are not getting handled sooner, because people can't afford to get the health care that they need, which puts our hospitals at risk too. Because if hospitals are carrying the burden of higher cost care, they need to get reimbursed, or they end up like eating the cost, which is not good for all of us. And then that gets passed on to the rest of us. So we should be doing universal health care, a transition to that. We should be phasing out the for-profit middlemen insurance people. We should have the large pool of risk. That way we're all getting covered and everybody can get care as soon as they need it at the lowest possible cost. And that includes people that are visiting the United States, whether they're citizens or not, because that's how other developed nations do it, wealthy nations do it. Because that's the cheaper way to do it, it's the humane way to do it. I would say that's a responsibility based on international law. You should want to do that. Like, you can best judge a society by, both by how we treat the least of us, the people that have the least in society, but also how we treat people that are visiting. How do we treat our neighbors, our friends from across the pond? Because it's one big world, baby. We're all in it together. And if we're doing low-cost care, it's less expensive anyway. So it's morally good, it's pragmatic, and it's also economical that way. But you don't hear this argument from corporate Democrats, really. You don't hear this from Republicans almost ever. And I haven't really heard Marjorie Taylor Greene propose solutions. She's just pointing at, like, hey, this is going to be a problem. Like, energy costs going up is bad. People's healthcare premiums going up is going to be really, really bad. And nobody's talking about it. And now she's getting punished for it. And, I don't know, Bernie Sanders catches hell for it all the time, but he still says it because it's still true. We still need to do something like this. There's other middle grounds. I say we should be talking about what I'm talking about, because that would be probably the best model, I think. I'm not a policy expert, so maybe there's some flaws there or something, but I think that would be a better model. And that's, to some extent, other countries have universal healthcare models, and they have better outcomes than we do. They have better care at lower costs than us. And that's got nothing to do with the makeup of the population. It's tax policy and our willingness to change our system so it prioritizes people instead of just profit. Because it bothers me that we have something like 50 to 60,000 excess deaths per year because of inadequate healthcare coverage. And that's people across the board. I don't think that's acceptable. Essentially, our country is saying we're okay with those deaths. It's fine. And the changes that Republicans are making are going to explode the number of deaths that we're going to see, and the number of medical bankruptcies that we're going to see, the number of foreclosures that we're going to see. That's going to hurt rural parts of America more than it's going to impact cities. It's going to result in longer lines at the hospital. And I think it's going to put people in really bad positions when it comes to all aspects of their care. And I don't want that for Americans. I'm really worried about that. I don't think we should be okay with that. And I don't understand how we're still doing this. We're still having this conversation. Like, we can't talk about something better. And to me, that's just not American. To me, America should be aspiring to always be better for all of us. And even people that are visiting. Mixed documentation, it shouldn't matter. Healthcare is healthcare. It should be a human right. No matter where you are in the world, you should be able to get care. And that should be what we're aiming to achieve. Like helping other nations once we all work together to figure it out. I don't think that's naive. I don't think it's remotely problematic. And I didn't have to insult anybody, really. I was just giving general facts. So it is what it is. You guys take care of yourself. I'm going to do a fun little short on this that I hope you're interested in. All right, take care. Follow me on Patreon. Hit all the buttons, do all the things. Like, share, comment, subscribe, and head on over to my Patreon. Please hit the like button and click the bell. The algorithms are not not being super nice to me these days. Maybe it's because I slowed my posting. I don't know. I'm not sure what's going on. Anyway, take care of yourselves, guys. Bye.